What about the external conditions confronted day to day? For instance, as much as 40% of people in the Navajo reservation do not have running water. How that affects their ability to combat this disease?
Oh, absolutely. And that's from a long state of histories with treaties and our relationship with the government. We've had set aside for certain things like that. And our infrastructure for water has never been at the capacity where we can provide water for everyone on the reservation. So you're telling people to wash their hands for 20 seconds, and yet people are trying just to get water, just to drink and just to cook with, and we know that water is part of a healthy body, so when you're trying to have people wash things all the time, we are struggling with just clean water in general.
We've worked in Navajo Nation for the last 5 years, since 2015, and have had partnerships. And I think it's important to know that before COVID-19, Indian Health Service, Navajo population, what we're seeing now is, this trajectory of an underfunded health system where IHS is funded 1/3 the rate per capita as the VA or Medicare. And, the level of inequity that you're seeing and the COVID cases that you're seeing in Gallup, as well as Chinle, it's part of this pattern. In Michigan and Chicago, we know that in Michigan, 14% of the population are Black folks, and yet 40% of the deaths are Black people. And in Navajo Nation and in New Mexico, 11% of the population is Native American, but you see almost 1/3 of the cases, COVID cases, being Native American. The outbreak, I think, in Navajo Nation is not a lack of leadership. I think President Nez has been incredible at having these weekend lockdowns, which is extremely difficult for the Navajo people, and is really leading with wearing masks in public. And so doing all the right things, I think, from the national sovereign level. And he's been very vocal to say that the federal response has been extremely slow. And that's what I've seen in Chinle, Arizona. We have HEAL fellows that are behavioral health coaches that are usually not taking care of COVID patients at this time. So they've taken over the cafeteria and are making PPE and sewing PPE. And so the whole cafeteria has folks sewing PPE. So I think you see from the top of Navajo leadership to the citizens and health professionals really leading an incredible response. And the federal government has just been incredibly slow.